All right, let's start. So welcome, ladies, to today's webinar, New Year, New Life, all about donating your eggs in 2023. If you're here, you're clearly interested in donating your eggs. And honestly, a big thank you on behalf of Fertility/Altrui, because currently there is a huge shortage of donors in the UK, and there are a lot of people eager to start a family, and they're just not able to, and they are missing that special ingredient and very important, which is you, and most specifically your eggs. So hopefully today marks the start of that journey. And as well, hopefully this webinar is useful for you all. And we are joined by three amazing women. Abby, she's our donor coordinator. Sophia too, she's not here today, but she's one of our donor coordinators too. Danielle, she's our senior fertility nurse. And Debbie, she's a past egg donor, one of our donor ambassadors. She has donated 3 times in the past. So she'll tell you all about her experience and any tips she may have. The structure of this webinar will be the first half, and everyone will introduce themselves, give you an insight of the process and a bigger picture. Abby will be mostly in the first half of your journey, and Danielle in the second half. They'll dig in deep soon about everything. And of course, Debbie is here to tell you all about her experiences. So Abby, the floor is yours.
Fab. Hi everyone, thank you for joining. So yes, as Sarah said, so I'm the one of the donor coordinators, and I've been here for around 2.5 years now. So if you were interested, I would be your first point of contact if you would like to donate. So if you were to book in your call kind of via the website or Facebook, you would come through to me or Sophia. We would start by just explaining what the process would entail. So kind of number of appointments. So generally, there's 7 to 8 appointments in total. Your first few appointments can be done from home. So there's an online counselling session and consultation, which you can do from home. We have something called the virtual pathway, which kind of allows you more convenience with your appointment, which is great. You would then have some blood tests done for genetic screening. So just making sure there's nothing underlying genetically. And then what we would do, we have ultrasound direct clinics all over the UK. So we would figure out where your nearest place would be for your scans, and then determining whether you would go have your actual egg collection itself through London or Manchester. We ask you if you could bring someone along with you to your egg collection, so a friend or family member. We would explain compensation. So as a donor, you are entitled to £750 donor compensation. So this money is here to kind of make the process kind of as easy as possible for you. So to get to and from appointments. So you can use this money, this compensation for, travel, accommodation if you wanted to stay in either London or Manchester the night before, childcare, so anything that's going to help support you during your journey. A crucial part of, and also important to mention, that you would receive anything left over out of your compensation if there's anything left. So the crucial part of the onboarding process is to discuss whether you would be eligible for donation. So before your call, we ask you to have in mind or at hand any medical issues within your family. So not only yourself, but first, second, and third degree relatives. So we would ask you about any cancers, about any mental health issues, autoimmune related diseases, autism, Asperger's. So we go through a number of questions. We also ask about any previous pregnancies and contraception. We hold weekly donor review meetings with our doctors and geneticists, where we talk through potential donors' family medical history. So we can kind of see whether it's safe for not only the potential child born, but for our donors as well. So, for example, say if one of our donors had depression and anxiety, we might ask for a GP letter just to say that egg donation wouldn't worsen their condition. So if we're all good to proceed, the next part of the process, we would need you to complete a personal profile. So this is a form that tells us and any potential recipients, just kind of gives us more of an insight into what you're like as a person. So kind of your interest and your hobbies. We also ask for 2 childhood photos under the age of 6. So the recipients can see these. We also ask for a recent kind of photo or selfie, which is purely for us for the matching process. At this stage, we also need you to do a small finger prick blood test for us. So we pop this in the post for you to do at home. It's called an anti-Müllerian hormone test, and it will just give us a really good indicator of your current fertility levels that need to be within a certain threshold to be able to donate. So once we have these results back, we can either book you in for your final call before matching, or if your result comes back and it's too low to proceed or too high, we can offer you a free of charge consultation to discuss your result. So once we have your result back, we'll book you in for your final call and we'll take you through the final stages. So kind of talking through the process, the timeline, medication, and the egg donation itself. We'll also ask you if you'd like to know the outcome of your donation. So whether it was a successful pregnancy, whether it was a live birth, boy, girl, or twin. So you can decide whether you want to know that, which is great. We'll also ask you things like your commitments over the next kind of 6 to 12 months. If there's any holidays booked where you're not around for appointments, that's fine. We just need to know. And lastly, any preference to who your eggs go to. So you absolutely do have a say in this. So, whether you're okay with your eggs going to a single person, a single woman, or do they have to be married in a relationship? And we also do get same-sex couples asked who need the eggs for surrogacy. So whether you would be okay with that as well. So yeah, from then, if you were happy with all the information, we would go live for matching, start looking for your match. And then Danielle will kind of take you from here, from what happens post-matching. Thank you.
Okay, so my name's Danielle. I'm one of the nurses as part of the donation team. So once the donor has gone live, you will then come over into my domain. You will meet with the advisor. So you'll have a named advisor who will help you through the process from start to finish. They're almost seen as a bit of a treatment buddy. They will stay with you. They work extended hours as well, just to kind of make sure that someone is there for you as much as possible. You'll have your first kind of initial call with them, and they will start to arrange some tests for you. The first thing that you will have is a counselling session, which you will be able to go over any certain anxieties, worries, and that's discussed within a safe space. Counselling is available to all of our donors throughout treatment and after, if that's something that they feel that will help them. And we encourage, if you do have a partner, for them to attend as well. Okay. Next up, you will then complete an extended history. So what that will ask you is to go through any past medical history that you do have, surgery, medication, and the medical history of close relatives. You'll have time to go through all of those questions with the doctor when you see them for your initial consultation. During the consultation with the doctor, you will go through the blood test as well that you obviously had with Abby right at the start. Following the doctor's consultation, you will then see a nurse, such as myself. That appointment normally just covers everything. So it can take a little bit of time, but it really tries to make a full picture up until this point, to relieve any anxieties, any questions you have, but it also is a chance to go through all of the consent forms. So if you are going to donate, there is quite a few consent forms that you have to go through, and it is our job, my job, to make sure that you understand those consent forms and that you understand the implications of them. We're governed by the HFEA, who are a big part of all the work that we do. Donation is anonymous up until the age of the child is 16. they can then start to access non-identifiable information, and at the age of 18, identifiable information. And within one of those consent forms, you will have a chance to leave a goodwill message, and that can be read by any child born from the kind donation in the future. We cover scenarios such as how long you would wish for eggs or embryos to be stored, and also your right to withdraw consent. So it's a pretty heavy consultation. We try and carry it out in an informal way. And I think that's really something that differs between a doctor consultation and a nurse consultation. And you've got the advisor on hand as well. All of these appointments are done virtually. So we can do them in lunch breaks. I've seen donors in lots of different situations. It's not a case that they need to take a day off of work or they need to travel. I see lots of donors sitting in their car at lunch, just kind of going through absolutely everything with me. So it's a very informal, but covers a lot of the legal side of it as well. Before treatment, you'll also have a scan. So all of the scans are internal scans. It's quite interesting. I think it's fascinating to be able to view your body in that way sometimes, to actually see. You can learn a lot about yourself during this donation as well. And we'll also do a full range of blood tests, and that includes a full sexual health screen and chromosome and karyotyping as well. Now, if anything comes back highlighted in those, you will either speak to a senior nurse like myself, or a doctor will go through with yourself with the results. All being well with that, you can then proceed to treatment. So the actual time of donation itself, the active treatment, is only around 10 to 12 days long from starting to the point of a collection. It's the bit before that takes all the time. So some of the results take around 6 to 8 weeks to come back. So when we do say to some of our donors, it could take 2 or 3 months to donate, that you're not in treatment that whole time. You're actually only in treatment for less than 2 weeks normally. It does require some injections. You will be taught how to do those injections. They are the smallest size needle that you can use. They're all patient friendly as well. So they are designed for patients to use them, donors to use them, rather than medical staff. We can supply videos as well for you. During treatment, you can continue your normal life. We do ask you to try and refrain from any form of heavy exercise. So, but spin classes, anything too mad, in my opinion. But I would say everything else just continues as normal, just from the fact that we ask you to refrain from that, and lots and lots of fluid. Okay. During treatment, you'll have 2 to 3 ultrasounds. They again will be internal. They will take 15 to 20 minutes max, and we will try our very best to try and get them booked in at a suitable time for you to work around all of your other commitments that you may have. Side effects is quite a common question that is asked. There can be side effects from the medication. They're hormones. Some of our ladies will have headaches. Paracetamol normally alleviates that, along with a good fluid intake as well. You may have a little bit of bloating, but that should not be anything extreme. The egg collection day is another day that a lot of our donors have lots of questions surrounding. It is done under sedation, so you are not aware of what is going on. It's not a operation as such where you have any cuts or sutures. It's done using the same probe that we scan you with. And it's very similar to having a blood test. A needle goes through the vaginal wall into the ovaries, and we remove the fluid. It takes 15 to 20 minutes. It's not without risks. There's always risks involved in everything we do in day-to-day life, but they are very, very minimal. And we will try and alleviate all of your concerns and questions that you have. Most of our donors are back to work the next day. Depending on what you do for a job, sometimes we do say it's better to just try and refrain the next day from work. We can offer letters to your employees if that's something that you wish. again, some people take that up, some others don't, but most of our donors are back doing their normal activities within a few days after collection, and life continues. I think that's me.
Thank you so much, Debbie. Could you tell us a bit about your experience? Any tips you could give?
Yeah, so as you said earlier, I've donated 3 times, and unfortunately I'm too old to donate again now, but yeah, it's something I love, something I'm really, really proud of, and there were 2 babies born from my donations as well, which was just amazing. It's just like the best feeling, and I think, you know, in terms of the process, it was really easy, and you know, it was, I wasn't having to go to London every other day for the scan. You know, they found a local clinic, so I could just, which was about 25 minutes away from me, so I could just drive there, have the scan. As Danielle said, it really is fascinating, because when to have these scans done, because you're watching these little follicles grow, and obviously, you know, if you've had children before, you're used to seeing babies in these ultrasound scans, so it's a bit weird seeing, like, oh, just seeing loads of these lovely little follicles instead, and you think, oh my god, you know, I think at one point I had like 20 on one of my ovaries, and I was like, oh, that's why I'm so bloated. But you know, it's just one of those things. And yeah, like side effects and things, like I didn't really have any. I was a bit, as I said, I was a bit bloated, and around the collections I was obviously a bit emotional because it's a lot of hormones and things, but you know, I wasn't screaming and shouting and rage at people. That's just, you know, that's a normal day for me, so I think it probably chilled me out a little bit, to be honest. But in terms of like the injections, if anyone's a bit nervous about that, then genuinely, like, if I can do it, anyone can. And I think you've just got to remember why you're doing it. And actually, you know, it's a second of, you know, of an injection, and I think you just have to remember why. Little tip, what I would do is get like a really cold can of either Pepsi, Max, Coke, whatever your drink of choice is, and rub it on the site that you're going to be injecting. It just helps numb it, and then you just get a little treat after with the drink. So that was always a really, really good one. And yeah, I mean, you know, especially like the first time, I'll focus more on the first time I donated, because obviously, ladies watching this will be the first time, will be the first time that you're looking at doing it potentially. So I think after I had the don't like calling it surgery, procedure, after I had the procedure, you know, I was away. I actually wanted to stay in the hospital because it was like so nice. It was like a hotel, and I was like, please, can I stay? They said no. So I went home, and yeah, I think I took about 2 days off work that time. That was just because I was milking it a bit, to be honest with my employer. But I didn't need to. I could have been back the next day. And it's just, yeah, it's really, it's the actual process. I can't explain just how easy it is, genuinely. And you know, that's why I've done it 3 times. And I think, you know, once you've been through it once, it is something that you think, oh my god, you know, what was I so concerned about? What was I worried? You know, and then you just do it again and again and again, you know, as well as many times as you're allowed, obviously. But yeah.
Great. Thank you so much. We are 20 minutes in. Maybe we'll cut this webinar a bit shorter. I have also seen that we have received a question, but I believe Danielle has already answered the question already. The question is, if there is a successful pregnancy, can the child request to know our identity later on? So Danielle, just in case, if you don't mind.
No, that's fine. So I can recap. So at the point of the actual donation, it is anonymous. Once the child or the young adult reaches 16, they can access non-identifiable information, and then at 18, identifiable information. So long term, it's potentially, it's not anonymous. The HFEA who regulate us will keep all of the donors that have donated on this register, but at the point of donation, whoever the embryos are going to, that is anonymous at the point of donation, but it is not from the age of 16.
Perfect. Thank you. Now on to the questions we have received when you registered. So question number 1, does donating eggs affect my own chances of getting pregnant in the future?
Okay. So to date, there is no evidence that it has a negative effect. How a round of donation or IVF works is we utilize everything that is within the ovary on that given month. So at the start of a cycle, a lady will have lots of small antral follicles sitting within the ovary, and naturally one will grow and one will develop and they will ovulate. What we aim to do is we aim to use all of those antral follicles that are within the ovary and utilize all of them. So that month, if you was not going to donate, one would grow, the rest would disperse off into the body. So it doesn't lower your ovarian reserve, and it should not affect you getting pregnant in the future. The only small risk is the risk of surgery. It's very, very rare, but it you know, there's always, again, as I've said earlier, risks if there's a complication. But from the fact of donating your eggs, it will not affect your chances of getting pregnant in the future.
Thank you. Next question. I feel like we have already gone through the process overall. So the question is, how does the process work? And how much time do I need for the procedure? Maybe should we just focus on how much time do I need for the procedure? Because how does the process work? It's a bit long and we've already gone through it.
Okay, so as I said, active treatment's 12 to 14 days. How much time the procedure itself, so the egg collection procedure itself takes 15-20 minutes. That day we would request you not to go back to work, so that is a full day, the egg collection, but don't be under any illusion that the egg collection takes a full day. You should be home 2 to 3 hours after. You have a nice cup of tea, some biscuits, and somebody will take you home. The actual aim from deciding to donate to donating, roughly, and Abby might pick up a different time, but I normally say roughly 2 to 3 months. But that also can be dependent on if you've got holidays. So if you said to us, look, I'm going to go away for a few weeks, we've got lots of different ways of being able to manipulate cycles to not mean that you've got to wait an additional month to donate. It could be that we want to just push it 3 or 4 days, but generally 2 to 3 months from start to finish.
Yeah.
Next question, is the process painful?
Certainly shouldn't be. I'd say more, you know, I wouldn't say pain. I'd say maybe afterwards there's, and again, you know, I'll talk about the first time, because this will be, you know, and it, you know, maybe a little bit uncomfortable. I wouldn't, you know, be going around bouncing on one of those bouncy hop things. I wouldn't be doing that afterwards. But yeah, no, it's just a little uncomfortable, but it's nothing that, you know, some paracetamol and a very large gin can't make better. So yeah, it's and as I said, you know, a lot of donors with Altrui are multiple donors as well. So it's one of those things where it's like, if it was that bad, we wouldn't do it again.
Thank you, Debbie. Someone just asked, and now live, do we know who our eggs are going to? Danielle, I think that's a question for you.
No, so it is anonymous that way as well.
Perfect. Next question.
Sorry to jump in on that, because it's something that I actually found really special as a donor. But from all 3 of my recipients, I got like cards and letters and things. So as much as, you know, you don't know that your egg is going to like Jack and Sally Robinson or whatever, you know, when you, if you are lucky enough to get, you know, a letter or a card, which most of them do, you do absolutely feel a connection with them, especially reading like how much it means to them. And, you know, mine put a little bit about their journey to parenthood and things. So yeah, as much as you don't have identifying information, you absolutely do have a connection with them. And genuinely, there hasn't been a day that's gone by since any of my 3 donations that I haven't thought about each and every one of them. And hopefully, you know, they think about me sometimes as well.
Next question, does donating your eggs affect your mood?
Okay, so no, in theory, we're giving you hormonal medication. So I always think it's worth saying that it can make you feel a little bit hormonal. It can be quite a daunting time as well, especially with the first donation. It's our job to support you through that as well, but it shouldn't have a massive effect on your mood at all. But any side effects from any of the medication are discussed with the medical team. If anything gets too much, or you feel that the mood is being affected in a really negative way, then that's something that we discuss as we go along.
Thank you. And last question is, when can I start the process of having my eggs collected?
Okay, so if this is in regards to when you can, you know, start your donation. So after this call, you know, Sarah can send around a link for you to book in your first call if you want to get things going. I have appointments early next week, so we could get started then. So yeah, we'll send you around a link, and if you want to book in your first call, no pressure, but yeah, we can get going whatever time you like.
Thank you, Abby. I see there's one more question that's just popped up. So do you have to come off contraception to donate? And do you have to be a non-smoker / drinker?
Okay, so you ideally can be on contraception right up until the point that we need to start on the medication, so 10 to 12 days before the active treatment starts. We would then need to take you off that contraception, depending on what it is. So if it's the oral contraceptive pill, yes. But if you've got a coil in place, if you've got an implant, they can all stay in. So you haven't got to have that removed. It's more the pill. We do ask all of our donors to either have protected intercourse or refrain during the active let's say 2 to 3 weeks of treatment to be safe, okay, but not necessarily to have the implant or the coil removed. It's better, you don't necessarily have to be a complete non-drinker, complete non-smoker. It's better to be living a healthy lifestyle, but that is more looked at on a case-by-case basis. During treatment, it is better to try and cut down on your drinking, and I say to a lot of my donors, think of it as a bit of a detox in lots of ways, but by all means, the odd glass of wine is not going to do anybody any harm, or the large gin after the egg collection, definitely not. It's encouraged.
Yeah, I had with the first time I donated, I had the implant. And then times 2 and 3, I had the coil. So, and as I said, there was 2 successful pregnancies from the implant and the coil donation. So, yeah.
Thank you very much. I'm thinking to cut this webinar short. In case you have any more questions, feel free. It's your time. And if not, maybe let's wait a little bit just in case. All right, I feel like all the questions have been answered beautifully. So we have reached the end of this webinar. Thank you all for joining, and obviously a special thank you to Abby, Danielle, and Debbie for all the information. And yes, so the next steps this week, you will receive an email with a link to Calendly to book a call with either Abby or Sophia. And in case you want to rewatch this webinar, we will also link the YouTube video recording of this webinar. And yes, hope it was useful, and hope you have a lovely week. Bye. Thank you.